Hello and welcome to a special interview for The Wire supported by Glenlivet Books. On New Year's Eve, South Africa removed and lifted the overnight curfew because the Omicron wave has peaked. So today we ask, as India enters its third wave at a fast and furious rate, are there lessons we can learn from the South African experience? And secondly, on Omicron, has South Africa sent a reassuring message to the rest of the world? My guest is the chairperson of the South African Medical Association, Angelique Coetzee. Dr. Coetzee, as I said in the introduction, on New Year's Eve, South Africa removed the overnight curfew because you believe your Omicron wave has peaked. So can I start by asking you, what is the data on the basis of which you believe the Omicron wave has peaked?
Yeah, thank you so much. And this is a very important question. If you look at the data from the 20th of December, you can see that there's a decline in numbers. It's, from 19,000, the next week 14, and then yesterday down to 8,000. Yes, we can always say that maybe not everyone went and tested. But even if I look at our hospital admissions, the latest data that we have was only 27 patients being admitted. And I think that was for the first, because this data was released yesterday. So it reached a peak, very, very steep peak in a short time of space. And then just as, as it, if you look at the steepness of the curve, it was extremely steep, got to the top, and just the same steep downwards curve. So I can't think that it would be different in most of the other countries because the virus would act the same.
Okay.
It won't be different for South Africa and different from India or UK.
In fact, the figures that you've quoted suggest that in just 2 weeks, the number of cases have more than halved, which is a phenomenal decrease. But is that true of the country as a whole, or is it really true just of Gauteng, where it all started?
No, it's true of the country in the whole. It is applicable to the whole of South Africa. If we look at the ICU, just before this interview, I looked at the data. If you look at the data of the 7th or the 2nd that was released yesterday again, there's only 310 patients across South Africa of 666 facilities that's been ventilated. And then currently in ICU, again, across 666 centers, it's 733 cases, of which, as I have just said, only 310 are ventilated. And then in a combination of ICU and maybe also high care patients, there's about 1,319 that only on oxygen. Again, if you look at this, it's totally easy to handle in the South African context.
So in a nutshell, in just 5 weeks, from the 24th of November, when South Africa notified Omicron to the world, till today, cases have risen dramatically, but tumbled down equally quickly. In other words, this has been a dramatic rise and an equally dramatic fall, and it's all happened in about 5 weeks.
Yeah. So also remember, we have clinically made the diagnosis on the 18th of November, but it's, it's 1 week difference between the clinical diagnosis and when it was announced to the world. But again, if you look at the numbers, and we have said right from the start that, yes, this is a fast-spreading viral infection, but if you handle it correctly at primary healthcare, there is actually no reason to get panicked, and people panic. They should not panic.
Let's then, at this moment, look at the nature of the disease that Omicron caused in South Africa. Do you have any sense of the percentage of people who were asymptomatic, the percentage who were only mildly affected with mild symptoms, and the percentage who were deemed to have serious illness and therefore required hospitalization? Do you have a breakup of the three?
Don't have the official numbers, but if I look at my own surgery, so since it started till last week, before the long weekend started, I saw 114 patients. Of the 114, only 3 had been admitted. And of the 3 that had been admitted, none of them had been ventilated or, being tubed as the way we speak. None of them, and they are already being discharged. And they started with a pneumonia. And the reason why I think they got sick is when they had been diagnosed by the lab, they didn't come to me. And unfortunately, 2 of these patients are severely overweight with diabetes. And again, when I saw them, they had pneumonia, admitted them. And as I've said, already within 10 days, they're back at home. The rest of my patients, mild, even pregnant women that I've seen, mild symptoms, they're all recovered.
But this is very reassuring. Of your own personal experience of 114 patients at your surgery, only 3 were admitted to hospital. None of them were ventilated, and 2 of them were severely overweight because of diabetes. And so clearly in their case, their problem was exacerbated by their comorbidities. Do you have any sense of how hospitalization rates across South Africa in response to Omicron compared to hospitalization rates with earlier variants like Beta, Delta, Alpha?
Yes, we do have that stats. So if you look at the current hospital rate or the length of stay with Omicron, for those who had been admitted to hospital for various reasons, sometimes people doesn't have the means at home if they are a bit sick. So the length of stay is between 2 to 3 days. That stats is out. And where, if you compared it with the Delta and the Beta variant, it was up to 2 weeks. So our data is definitely the severity of the disease, as I have said, especially for those who has been vaccinated. And remember, those 2 patients has been vaccinated, although the one hasn't fully been vaccinated. And if I talk about weight, the one was 150 kilograms, the other one 160. So it's severely comorbidities that they have, but discharged.
But you're saying something very important. You're saying that the average time spent in hospital because of Omicron during the present wave is roughly 2-3 days across the country. Earlier with Delta, it was 2 to 3 weeks. So it's a fraction the rate this time compared to what the hospitalization rate was earlier.
Yeah, we don't have all the stats in ICU, but if I look at our ICU numbers, you can also see that, especially for those that has been vaccinated, the stay is not that long. To have currently 1,390 people in our ICU and high care facilities. I remember you stay there, sometimes in the high care and ICU facilities, you can stay up for 2 to 3 weeks. So sure. Even that is not a high number if you look at the infectivity rate in the cases.
Now, in fact, I've read reports in newspapers that suggest that a large percentage of people who did end up in hospital in South Africa were only incidentally COVID. In other words, they'd gone there for some other reason, an accident or a broken arm or a surgery, and were tested out of caution and found to be COVID. But they're not actually people who went to hospital because they were suffering from COVID.
Yes, you are absolutely correct. It's incidentally, and that's why in the beginning, when the children, that data that came out, everyone was so upset and said, yes, but look at the children is getting more infected. While when we looked again at the data, especially with the Discovery Health data, it was clear, again, those children has been admitted for something else and coincidentally positive. So, and that's what we see, even in the surgeries when people come in, we have this tendency now, or this protocol in place, each and everyone, if you come in and you complain in my surgery with anything related to an upper respiratory tract infection, whether you're only telling me that it is a postnasal drip that you have, we will test you because of the mildness of the Omicron and the difficulty for the patients to be able to tell you they feel different then.
Absolutely. Tell me, Do you have in South Africa any sense of the percentage of people who became seriously ill who were unvaccinated, the percentage who became seriously ill who were only single jabbed, and the percentage who became seriously ill who were double jabbed? Do you have that breakdown in the country?
Yes, so again, we look at the data from Discovery Health. There, I must say that if you have only one vaccine, you will also fall under unvaccinated because you're not fully vaccinated. Remember, you have to have your 2 jabs, and around about 2 weeks after the second Pfizer, you would get enough immunity. So currently, the latest data, 88% unvaccinated in ICU, and the rest vaccinated.
That means that the vast majority, preponderant majority of people who ended up in ICU were unvaccinated, which also says that vaccination, perhaps including boosters, is actually a great protection against serious illness. That is the same with Omicron as it was with Delta and Beta earlier.
Yes, absolutely.
Do you have any sense of whether the majority of people who became seriously ill were young, or is it across all age groups?
It is across all age groups, but I think, if I'm not mistaken, it is mostly above the age of 30. The majority would be older than 30 in the ICUs lying there. And the 2 patients, the 3 patients that we have sent, both are above the age of 50.
What about the death rate during the Omicron wave? Was it the same as the death rate you experienced in the country during Delta, Beta, Alpha, or was it different?
It was much less, or it is much less. If you look at the data that we had of a beta, in the peak of beta, there was, and that was on the 11th of January, 19,000 cases per day. And then in hospital on the 19th, 17,000. If we look at Delta on the 8th of July, 19,955 patients per day, and on the 14th of July, 17,000 were in hospital. And then on the 10th of July, that data says 2,597 in ICU. While if we look at the data of Omicron, you can see it's much less, as we have already discussed. Hospital death rate also very, very low. As I have said, I'm trying to see, if I can, on the 21st, 35 patients, on the 20th, 105. The data yesterday that was released only no, I don't have yesterday's data on death, but it's really very, very low. Not the same than with Omicron, with Delta. Delta is a terrible disease. I must say to you that I'm very scared of Delta. Delta gives severe disease, even in primary healthcare. We have seen these patients, we have followed them up. The most complicated, the patients who would get complicated with Delta is between day 7 and day 10. With Omicron, after day 7, they're fine. They're not getting sick, especially if they went to the doctor.
This is hugely reassuring for an Indian audience, Dr. Coetzee, because we experienced a massive second wave in April and May with Delta, when cases were increasing at a 414,000 a day. And at the end of May, deaths were at 5,500 a day. So if you say to us from your experience of Delta and Omicron is nothing like Delta, either in terms of illness or in terms of death, that will be very reassuring to Indians as we enter our third wave with numbers increasing almost dramatically every single day. But one more question about Omicron, and that is this. What do you think, as someone who's there as the head of the South African Medical Association, explains its mildness? Is it intrinsic to the variant that this is milder? Or is it also because South Africa has a fairly high percentage of previous infection? And is it also, thirdly, because of vaccination. I know vaccination levels in South Africa don't compare internationally, but you're amongst the highest in the continent.
Yeah, that is a very interesting question, and I think there's a lot of different answers to this. And again, about 44% of our adult population is being vaccinated, and that I think counts less than 30% of the whole of our population. If we look at, yes, a lot of people had Delta, but maybe subclinical as well, or being in contact with family members and asymptomatic got antibodies without them really being sick. And then again, the vaccines also help. We know that the vaccines will not protect you that much against mild disease, but in this case, the disease is mild, so that the protection you do get, again, makes sure that these patients still recover within 5 to 6 days maximum. But I think one of the things that is important to understand in South Africa is we never discarded the wearing of masks. And I'm going to say it again, you cannot vaccinate yourself out of a pandemic. But what you can do is you can use your common sense, where again, the gatherings, stop that, big gatherings, stop that.
Let me interrupt and come to that, because we're coming to the end of the interview, and I want to talk about precisely the issue you've raised. South Africa is clearly past the worst, and therefore, not only do we have lessons to learn in India from your experience of Omicron, but we also have lessons to learn from the sort of health protocols that you continue to observe. You're saying to me that mask wearing remains essential even after the peak is over?
Yes, there is no, even with the restrictions being lifted, mask wearing is not lifted. And I think it's extremely important that people understand that, because that's the common sense that we're talking about. It's the mask wearing. The ventilation, it should be, and that is, especially in the public sector, that should be the responsibility of the government to make sure that there's good ventilation in their public facilities. And then again, the social distancing, because this virus, part of it is definitely airborne, and then it's droplet as well. So the mask, and that's why I keep on emphasizing a clean mask every day. And you can wash your mask.
Tell me something. Should masks be worn only outdoors and in public places, or should they also be worn indoors, even when you're with not your family, but just a few friends who've dropped over?
If you know that all of you have been vaccinated, and you know that there's good circulation, ventilation where you are sitting indoors, all the windows is open and there's a slight wind coming in, and you sit 1.5 meters from each other, you don't have to wear your mask. But if you're not sure that everyone is being vaccinated recently, there's no real good ventilation. Rather wear your mask. It's for your, so your mask, for the other ordinary person out there, is to protect when you speak, to protect that you do not spread droplets to someone close to you who might get infected. So it doesn't protect you,
but it protects
from
them.
not getting. Yes. So, and if we can contain the virus in that environment with a mask, you don't spread it.
Absolutely. My last question, what about large gatherings? And let me explain why I asked that. Massive political rallies are taking place in India. And as we approach state elections in February, March, those will increase in number and in frequency. And already at the massive rallies that are being held, hundreds of thousands are gathering. Certainly there is no social distancing, and almost certainly there are no masks being worn either. Is that playing with fire?
Yeah, that's definitely playing with fire. That will become super spreader events. And it doesn't matter how many times you try to make it better, how to negotiate around that. It's impossible. You cannot control a big gathering of people with 1.5 meters. You cannot do that. Even if it's outside, you cannot, and they will not wear their masks. That's human behavior. So you have to take human behavior into consideration. The fact that you are vaccinated, remember what we have seen with these vaccines, with Johnson & Johnson and Pfizer, about 3 months later, after we're now only starting with boosters, you can get infected, although you're going to get it mild, but you never know who's going to end up in hospital. But so vaccines, not the only answer. It's the common sense.
And the most important thing is wear a mask as often as you can.
Yeah.
I thank you, Dr. Coetzee, for giving us this detailed idea of the experience in South Africa of Omicron. And the one thing I want to point out to the audience in India is that cases rise dramatically, but they fall equally dramatically. And in 6 weeks, they shot up and they tumbled down in South Africa. And the second thing I want to point out is that the disease is mild. The percentage of people in hospital is a fraction of earlier waves. And they were largely people who were unvaccinated. And as you said, from your personal experience in your surgery, only 3 out of 114 had to be admitted to hospital. None of them were ventilated, and 2 of them clearly had problems connected with overweight and diabetes. All of this will be very reassuring to an Indian audience. But the bottom line is, you must wear a mask. That is the best protection against the risk and danger of your being the unlucky minority who gets it. Is that right?
Yes, you have to. And a clean mask.
Thank you very much indeed, Dr. Coetzee. I appreciate your joining us. Take care, stay safe, and thank you very much.
Thank you so much, and please stay safe, and please just do the simple things. It doesn't lie in the complicated. We make this so complicated. We should just make it easy.
Absolutely. And the easiest thing in the world is wear a mask.
Yeah.
Thank you.